Good morning, everyone. Thank you very much for participating in this webinar called Without Access, There is No Health, the Patient's Journey in Mexico. I am Joselyne Rivera, General Manager of a Public Affairs Agency, and I am very pleased to moderate this conversation. This is the first time we are doing this, and we are very excited that Mexico, as a LatAm country, starts with this webinar launching. We are grateful for the participation of the experts who join us today and going to talk us in depth about a very relevant topic, access to health services for patients, the challenges, the opportunities, and the solutions. Our discussion today will always keep the patient in mind. Mexico has a fragmented healthcare system, which makes the patient journey complex. The cost of oncology treatments is quite high, and the process of reimbursement makes the duration of the treatment longer. To delve deeper into this topic, we have Valeriia Mykolaienko, Regional Operations Lead at Axios International, a global company with over 25 years of experience dedicated to design and implement healthcare access programs. Axios International has introduced innovative access solutions that complement the existing healthcare systems. To make access reality, Axios collaborates with local stakeholders, bringing global healthcare expertise to ensure patients receive the right treatment at the right time, helping them afford the treatment. Thank you, Valeriia. During recent times, there have been many structural changes in the Mexican healthcare system in search of free services and treatment for all. A few years ago, the Seguro Popular was eliminated and the INSABI was created, which was recently replaced a year ago by IMSS Bienestar, which is the main institution for the non-social insurance population that seeks to attend over 60 million of people, funded by general taxes and integrated by local hospitals of the states that voluntarily signed the addition to this new system, and also the high specialty care is given by the federal institutions. We also have us today, Dr. Laura Suchil, a clinical researcher who has extensive experience in supporting patient programs. She will talk to us about the challenges of the patient treatment journey in Mexico from the clinical and institutional perspective. Thank you, Doctor. It is also important to note that in this digital era, the search of health information begins on the web. According to data from the last National Health and Nutrition Survey, 72% of the Mexican population search the health information on the internet. However, we don't have an integrated national big data system on health. Also, since the pandemic, virtual medical appointments has become an option for many patients. However, there is a marked access gap to this type of tools. Despite technological advance and the development of telemedicine, face-to-face appointments continue to be bread and butter, especially in Mexico's public health sector. On the other hand, access to specialized care also presents challenges. The National Institutes focus on high specialty care attention are over their capacity established and have a high concentration of patients referred from local hospitals. To explain how to navigate the patient journey and the needs from the patient's perspective and organization, we have Leticia Aguiar, an expert consultant from civil society organizations, NGOs, mainly in cancer. Welcome, Leti. So with this general introduction, we can see the patient's journey in Mexico is marked by many factors, ranging from the patient's economic condition to the region where they live in Mexico and the access they have to health information. So let's start this conversation with the first round. I would like to ask first, Valeriia, how does Axios International complement local healthcare systems?
Thank you for introduction, Joselyne, and hello, everyone. So as you mentioned, we as Axios, we work with the local stakeholders on the market, and we bring the global expertise in order to help the patients get the right medication in the right time without having to make really huge sacrifices to afford this kind of treatment that has been prescribed by their treating physician. And the key focus for us is on access to treatment by addressing, first and foremost, is the affordability barrier. Because it is important to understand that it is crucial for the patient to get the treatment properly and take the treatment according to their prescriptions of their treating physician. And it is important for the patient to complete the full course of treatment. Otherwise, the patient just won't be able to reach the most medical benefit from their treatment. And therefore, it becomes critical to ensure that the patient completes the whole journey. And at Axios, we do it by using our validated proprietary tools, such as PFET. It's the Patient Financial Eligibility Tool that helps us assess a patient's real ability to pay for the treatment, considering the three major aspects, such as income, standards of living, and assets. It really helps us identify the financial support that the patient would need in order to complete the full prescribed course of treatment, even if they cannot afford to pay for it in full. And the beauty of this tool is that it is customized to every local context, which makes it very relevant at each market. And at this point, we have been using it for years. It is widely used across 30 countries across the globe. And we see that the patients accept it very well. We have assessed over 23,000 patients using this tool. So these types of innovative approaches really help us address these types of challenges, the affordability challenges that the patients are faced. And once the affordability barrier has been addressed, then we start providing patients with more customized support so that they can stay on treatment and get the best out of their medications.
Thank you, Valeriia. We get back to you soon. So from your perspective, Dr. Suchil, what are the main challenges of access to care and treatment in Mexico? Your microphone. Thank you.
Thank you, Joselyne. Good morning, everybody. I'm very pleased to be here with you and to share experiences with my colleagues in the table. Access to care and treatment in Mexico faces several challenges, reflecting a complex interaction of social, economic, and healthcare service factors. Mexican patients may experience obstacles in navigating our complex health system, resulting in delayed diagnosis and treatment that affect their health outcomes. Navigating the fragmented systems also leads patients to confusion and frustration and less satisfaction and engagement with their care. 4 years ago, in 2019, as Joselyne mentioned, the government embarked on a complex, extensive health system reorganization with the goal of providing healthcare services to these 66 million people without social security and advancing the idea of universal health coverage. The newly created agency, called the IMSS Bienestar, is designed to provide universal access to health for all Mexican citizens, particularly those who are not covered by social security programs. One of the key changes introduced by this agency was the elimination of user fees for medical services and medications in public health facilities. This will reduce the financial barriers to access. IMSS Bienestar also expands coverage to provide a large range of healthcare services to a broader segment of population, and it's designed to work along with social programs to address broader determinants of health, including social and economic factors. Of course, the implementation of this new health policy has faced challenges. This includes lack of clarity and communication of the transition process from Seguro Popular to IMSS Bienestar. What is the role of this institution and how it could operate? In the fundings, very important, the fundings to provide quality services. Other concerns are maintaining the supply chain of medications and medical devices, necessity of reducing bureaucracy that prevent effective and efficient function and confuse everybody, staffing, training and retention of healthcare professionals, an issue that Mexico is now trying to see how can solve these deficiencies, and the potential impact of the changes on the overall quality of healthcare services. This transition process also had significant effects on patients' journeys. They may experience gaps in their medical care leading to suboptimal treatment. They may also face obstacles in navigating a more complex system. If it was complicated, now it's very complex, which can lead to delayed diagnosis and treatment, inefficiencies, duplications of services, unnecessary tests and procedures, inconsistent care or inadequate coordination, and less patient satisfaction could be other issues and barriers that patients are facing. Of course, we are very concerned for persons in underserved communities or with limited access to resources that could face greater barriers. Public policy implementation, we all know, often involve ongoing adjustment, we are waiting for it, and improvement based on feedback and experiences in practices. But we all need to contribute to better health outcomes and overall well-being in this new system. It is necessary a more patient-centered approach that prioritizes the unique needs, preferences, and experiences of each individual.
Thank you very much, Dr. Suchil. And then, Leti, you heard about our specialist just tell us what the patients are facing and how the navigation is in the system works for the patients.
Well, first of all, thank you so much for the invitation. It's a pleasure to be here with my colleagues. And well, one of the first hurdles or obstacles that patients face right now is out-of-pocket expense has increased in the last years. So that makes it so difficult for the patient to begin the journey. No? And also, once the journey has begun, there's the delay on the appointments. There's not enough specialists. So the time lapse between the first symptom of the first appointment to the specialist sometimes could take about 6 months, maybe a year. So the result is that we have late diagnosis or in later stages of the disease. And regarding health literacy, it's a big problem because the patient normally doesn't understand the progress of the disease and the stage on which they are. So sometimes when the first line of treatment fails, the patient feels discouraged. So the adherence to the treatment is complicated by that. And other part that is important is that the care doesn't end with treatment. There are consequences to the care. The patient sometimes has to get back to work, has to get back to the place on the family that they had before, and there's not a support system within the healthcare as we know it right now that could provide all that guidance to the patient. So we have, as organizations, really a lot of work to do to help the patients in all of that aspects. We have try to make a patient summits, where we are trying to give that information to the patients and the caregivers so they can have understanding that they can be part of the decision-making process of their treatment.
You point something very important, which is the vulnerable groups, the lack of access and the lack of treatment. So, Valeriia, what initiatives does Axios International have in Mexico for those vulnerable groups?
Thank you, Joselyne. Yes, so in terms of what we do in Mexico, at this point, we are running 5 active programs in Mexico, and we are focusing on these key disease areas such as breast, colon, ovarian, and hematological cancers. And in the programs that Axios is running, we use the innovative approach. These programs are called patient assistance programs, where patients are able to pay according to their financial capability and receive the remainder of the treatments through our programs. And this becomes possible using the tools that I mentioned previously. And what we've observed is that this has been highly impactful in our practice, as we have seen that the patients continue their treatments for longer and really achieve much better lifelong benefit from such treatment.
Well, I think it will be the time right now just to hear at this point of the conversation, it is very important to listen to a patient testimony regarding what just Valeriia presented us. So Francisco is in the Actions Assistance Program. Unfortunately, he was unable to join us today. He is a lung cancer patient, but he sent us an audio to share with all of us how he has faced the treatment process, how his journey has been through the healthcare system, and of course, his recommendations for other patients, other oncology patients, so they can be better navigate in the system and learn about his experience.
Hello, my name is Francisco Rivera. I'm 54 years old and live in the state of Morelos, Mexico. First of all, let me thank you for the opportunity to share my experience. My cancer was detected by accident, already at stage 4 in the summer of 2017. I had problems focusing with my left eye, and a small tumor had grown inside my eye. Later, the primary tumor was found in my left lung. I consider myself lucky because I found a very professional oncologist, very human and considerate, who offered the best option at the time. In the course of these 6 years, I underwent 3 surgeries, 5 radiotherapy sessions, and have used leading-edge medication that helped me cope with the illness with a very high quality of life. I know the limitations of the public health system in Mexico. Therefore, I went directly to seek private consultation, and time and quality of life has proven it was a good decision. At a certain point, the coverage included in my medical expenses insurance was exhausted. Cancer is a very expensive illness. Then my doctor recommended me other options to pursue. First of all, never take health for granted. I couldn't believe I had gotten this disease. There are a few conditions that favor lung cancer. I had none of them and still got it. Pay attention to all symptoms. Second, get a good healthcare insurance. Better to have it and not use it instead of later regretting for not having it. Stay close to your doctor. During my treatment, all the time I was feeling well, but a close monitoring by my oncologist showed that 2 years after I began my first medication, the disease formerly under control had suffered a mutation and it was coming back. Right on time to take countermeasure and switch. Lastly, but that's quite important, lean on your family. Talk to your friend. Cancer is already very tough. No one should live this experience alone.
Thank you. Well, I think the testimony of Francisco is also very important to just see what the integrated and the multi-stakeholder approach of cancer has to be done to get a full access treatment. So let's start this second round of the conversation regarding what Francisco tells us. So Valeriia, you previously talked about all the program that Axios International bring, but I think this is very important also to point the multi-stakeholder approach, and why does this approach is important to access healthcare?
Yes, so as I've mentioned, the types of the innovative approaches that we use as Axios at the Mexican market allows to connect all of the stakeholders on the market, such as the pharmaceutical companies, such as companies like Axios, the hospitals, the physicians, the pharmacies, the NGOs, institutions. It allows for these stakeholders to connect and direct this partnership effort in addressing the patient's needs. So in scope of this innovative patient assistance programs that we are running, we are using such models as multi-stakeholder cost-sharing approach, where various stakeholders share the costs of patients' treatment between themselves, which allows to address these affordability barriers for the patients in a more sustainable manner. So it becomes more possible for such programs to exist for a longer time and also help reach greater numbers of patients and help more patients. And in addition to working with multiple partners and having this multi-stakeholder approach, it's also important to understand that the patient's journey and all of the challenges that the patients are facing across this journey are quite complex. We have been on the market for over 25 years, focusing specifically on access solutions. And we learn to understand these specific challenges and the best solutions in order to address them. And what we've learned is that each individual has very special challenges that they're facing. And this must be addressed in a very customized way with more complex multidimensional solutions. And we focus on access to treatment, and then we start focusing on adherence. This is something new in the region, something that is still in development. And we are looking into these types of solutions so that we can provide more holistic support to the patients, address their challenges even beyond affordability. And at the end of the day, by customizing our services, we are addressing the individual partners' patient's needs, which also makes the patient intervention much more effective. And it is more efficient and sustainable for the companies sponsoring these programs or the institutions that are sponsoring these programs, which in turn helps to run these types of initiatives for longer.
So taking about that multi-stakeholder approach, Dr. Suchil, how do these patient programs are taken or are seen by the institutions in your experience?
Well, of course, they are very necessary. As was mentioned, treatment for cancer is very complicated, very complex, and patients face many, many situations. So everything that could help them to complete treatment, to adherence, and to give facilitate all the process, it's welcome. Sometimes it's difficult to implement these innovative proposals because of administration situation, but of course we are open to receive them and to offer them to our patients.
And Leti, about the participation, of course, the participation of the NGOs in these kind of programs is the key. Can you tell us about how does the organizations participate in these programs and with in navigation programs?
Well, first of all, I agree with Valeriia that all the patient's journey is really complicated. So the first thing that as patients, groups, organizations, we need to understand that we need to adapt to all the different circumstances of the patient journey. For instance, sometimes the focus could be on diagnosis, sometimes the focus could be that there is not a test available, sometimes could be that there is not enough specialists, as we mentioned before, and it varies also within the country. It's not the same on the capital that is in another state. So as organizations, we need to gather information on the moment so we can understand what is really happening with the patient and we can help them better. And also we need to systemize the information that we have, because data collection is a key factor for organizations, and we're not doing, I believe, enough good work in having that information in a manner that we can share between us and these different stakeholders. So everything is not only the system that is fragmented, but the information is also fragmented. So the decision-making process is complex for that. And as Dr. Suchil mentioned, sometimes bureaucratic hurdles are difficult to navigate. So we need to have a communication with leaders that is not politicized. We don't have to take part of any political vision. We are there for the patients, and that has to be our main focus, so we can have this dialogue that is objective for the problem has to be solved. And that has helped us a lot trying to make Alliance work as a network of organizations, but because that is also important. There's some organizations that focus on some issues that help, for instance, on treatment. Some other organizations help with tests. So having these networks help, because when one patient comes and I don't have the way to help that patient, I know there is another organization that could help him. So that's how we're trying to work right now.
Thank you, Leti. And I also want to go back to Dr. Suchil. You have worked together from the institutions with the NGOs. Can you share us some of the best practices of this collaborative work?
Yes, of course. Well, sometimes working with organizations is very important for patients, and it's important because they can provide access to some services and some support that we don't provide in the institutions. Usually institutions are overwhelmed with all the patients they receive. They don't have enough personnel and enough resources, economic resources to offer all the patient need. So working with the organization help us and help patients to receive and to feel and to make them feel better in this journey they are experiencing. So working with organizations was one key element in the policies in the National Cancer Institute, for example, because working together, we understand that it's not enough to give a great experience or a better experience to a patient. So we know that we have some field, but we need support. So we start working with organizations, and we can build many programs to support them. Navigation for patients was easy. We found in the community all the resources we need for them. For example, housing, transportation, information. We have our own information systems, but we need to empower the patient. We need to go with them and to repeat 1,000 times if it's necessary for them to understand that they have a disease. And to segment all this information, to provide them depending on the moment that the patient was or were. And for that, you need people doing that. And sometimes institutions are very constricted in personnel. So we work with NGOs. We develop wonderful programs like navigation or information. They help us to support patients, and it's very interesting that with as long as the time passes, NGOs become more professional, they have more skills and capabilities, and they understand that support patients are more than giving them some resource, no say drugs or something that they can provide to patients. They understand that we all are stakeholders. We all need to be prepared, educated, to know more. And like Leti says, to start producing data to take better decisions. If we don't have data, we can't decide, we can't program, we can't plan. So it's very important to ask the patients what are their needs and to try to put them in databases and analyze and see how we can develop plans and other programs to help them. So I think that collaborations, institutions, NGOs is very important to support patients with all diseases, but mostly in cancer. That is a very complicated disease.
Yes, and also like innovative programs as Axios International. I think there is the elements joined together in perfectly like it's a great element. So we all agree that I think we all can agree that we have huge challenges in Mexico, beginning with the fragmented system that leads in a fragmented information and of course different types of access to treatment or to full treatment or to patient support programs. So I would like to ask you, like, regarding all the challenges you just told, if you can tell us what are the opportunities that you are seeing in Mexico towards the next year and the implementation of the healthcare system. So Valeriia, I would like you to hear about, from the perspective of Axios International, what are the opportunities facing those challenges you told us before?
So, as I've mentioned, one of the key challenges that we still see in Mexico and Mexican healthcare system is being able to access the innovative medications, and the affordability remains a big challenge, one of the key challenges. So one of the key opportunities is to continue working in that direction, addressing the affordability challenges in sustainable manner by working together as partners with various stakeholders on the market. But also one of the biggest opportunities that we see is related to having more holistic approach to supporting the patients, because we see that majority of the patient's journey is happening outside of the hospital setting. And we as Axios are looking specifically in this element of the patient journey, how we can support patient better outside of the hospitals, which also helps to build the capacity of the healthcare system, because now we have been facing unprecedented challenges ever since the COVID time, and there is definitely a need to support the patients in this area. So when we're talking about the holistic type of support, as mentioned already by Dr. Suchil and Leticia, is that it is important to provide the education to the patients to close these gaps in the information. And what we've seen over the years of working with the patients is that when the patient is engaged into their treatment, when they're actively participating in it, and when they feel accountable for their treatment and the results of their treatment, it actually brings better results of their treatment. And we feel that the empowerment here is key. So we need to empower the patients. And when the patients come to our programs, we still see that the further education is still needed. So we would need to show the patients the value of the treatment. So understand the importance of the treatment, of following the prescriptions and recommendations of their treating physician, really teach the patients on the disease management and treatment management, And we currently do that. We provide this type of support by our local counselors and also via our digital platform that is called Axios Plus. This targets patients, the physicians, and also other stakeholders on the market, such as pharmacists, for example, who are also a big part of the whole process. And as Leticia mentioned, also it is important to collect the data, like the digital direction of development is also a major opportunity. It is a key to ensure the development of the healthcare systems to collect the data, be able to draw the conclusions of this data, and use this data to help address the challenges that the patients are facing and the healthcare systems are facing.
Thank you, Valeriia. That's very interesting. And Leti, you want to complement those vision and with the patient and organization's perspective?
Yes, first of all, I love the concept that Valeriia just mentioned, that holistic approach that we need to have as patient groups and overall on the systems. So thinking of that, also, I believe the part where we can prepare the patients not only for their own disease, but to take part of the health system reform. That is important because right now there is an opportunity that is being provided by the government about the new architecture for social participation on healthcare. So there are going to be these spaces for patients or for patient groups to participate in this, to evaluate, to try to make more closer to the knowledge of people how the system works. So, but the patient needs to be educated to occupy those spaces. So we also mention sometimes the patient-centered care system, but it's only sometimes in the concept, it's not a reality. So we need to work on that. I believe that is an opportunity so that the patient, Dr. Suchil mentioned empowerment, but empowerment means not only for my disease, but also empowerment for the things that I can do for others with my experience. So that's something that we can inspire on patients and caregivers as well. And also I want to talk about a little bit about medical protocols and medical guidelines, because this year, I believe the breast cancer was updated and published. So I think that in few years, there are more types of cancer that are going to get those protocols updated. So that is important because the new drugs, the new treatments can get established there so the patients can access them. So I believe that's another opportunity.
Thank you, Leti. And Dr. Suchil, you want to close with your conclusions, please?
Oh, yes. I think that there are many things we can do to improve the patient journey. We have mentioned some of them, and I want to talk about the importance of digital health solutions. We need to give the patients the opportunity of having these kind of dispositive of applications, apps that can use and that help them to navigate the health system. And besides that, telemedicine is very important for the country, considering that we are a large country and that there are many communities that don't have any access to care, to health care, and it's necessary to work on that. And of course, talking about the technology, it's urgently that we can have an electronic electronic
record
for patients in order to have all this information in a system and to have access to them and make easier the treatment, but at the same time have all the information we need for politics and for programs.
Well, as you can see, we have many challenges pointed out, and also huge opportunities in the patient journey that all the patients, oncologist patients in Mexico can be overcome by finding new ways to connect. It's a long way from get the initial information about the disease, the early diagnosis, to finally get the full access to treatment or rehabilitation. Access, as you all three said, is about transforming the healthcare delivery. The digital tools, the access to medicines, and the specialized care require a comprehensive and holistic, and integral solutions that should be available for all Mexicans, no matter if you are in a contributive or non-contributive healthcare system. The complex system, complemented by solutions such that those provided by Axios and other stakeholders like NGOs, creates a resilient and adaptable healthcare ecosystem centered on the patient. This collaborative approach leads to more resilient and responsive healthcare system that improves health outcomes and well-being. I want to thank you, all you experts, Valeriia, Dr. Suchil, and Leti. Thanks everyone for your participation, also Francisco for his testimony. It has been a very enriching session, and I want to thank you all. Have a very good day. Thank you.
Axios, transforming access to healthcare.